We're back with you tonight here on News at Prime. Your reporting continues. We are in the Limpopo province where the health MEC in that province, Dr. Poppy Ramathuba, says the province has recorded its first case of monkeypox. She says a 42-year-old Swiss tourist visiting the country is currently in isolation. Ramathuba adds that 3 of the men's contacts have been identified but are yet to present any symptoms.
So in this case, we've been able to pick up 3 to be contacts. And what we're going to be doing and what we've started is for the next 21 days, we'll be closely monitoring these 3 contacts. If any of them can develop any symptoms or signs, we will therefore collect specimen and take for the laboratory to be tested. But as it is for now, the treatment, because this is a mild form of the disease, doesn't warrant hospitalization. Isolation is important. What we do is that we will not necessarily dictate where the person is being isolated. What we always do, we are in close contact with the lodge management, and we are satisfied in terms of them, because what comforted me was the reports that we have is that all the staff in that lodge, like many other lodges, they are still very religiously wearing their mask when they are serving their customers. Even those that are cleaning our rooms in our province, we still continue to encourage them to be able to wear their gloves, because they will never know. Diseases is not just monkeypox and COVID-19, but COVID-19 has taught us, let's go back to the basic hygiene principle. We have dealt with the West, which was COVID-19. Hence, we are saying to the people of Limpopo, our life must continue as long as we follow basic principles in terms of public health, how to protect ourselves. If we continue with our hygiene, washing of our hands with water and soap. These days we've been taught about sanitizers where we do not have water and soap. And we're encouraging those who used to donate sanitizers to schools where we don't have water to say, please continue, don't stop because you are told that we are no longer dealing with the waves of COVID-19. The reality is that there are many other infectious diseases which are out there. So the basic hygiene does not necessarily deal with COVID-19. So for us, we're saying we're not really worried because we understand how monkeypox transmits from one individual to another.
Now, for more on this, we're joined now by High Health CEO, Prof Ramneek Ahluwalia. Prof, good evening and thank you very much for your time. 3 cases now having been confirmed in South Africa. Previous 2 cases were of males who had no history of travel. This particular one in Limpopo is a Swiss tourist who is visiting the country. Those circumstances, do they make any difference as far as what we need to do now in terms of our control of the disease?
No, absolutely, Thabo. Thank you very much for having me and good evening to everyone. Thabo, first of all, monkeypox is not as contagious as COVID-19 is. And I think monkeypox is not an airborne disease. And what the MEC was saying is correct. It's a disease that spreads mostly from a physical contact predominantly, and a prolonged physical contact where you have a body fluid which is infected with the monkeypox, which is predominantly because of the rash or the fluid that accumulates under the skin gets exposed to another individual. And that's a very important point because at least we are not battling an airborne disease like we're battling COVID-19. But what worried us was the first 2 cases, because with no history of travel, clearly says that there was a kind of a small community transmission that's already happened in South Africa. And that's bound to happen because our borders are open. We have a huge bilateral trade with Europe and US, where predominantly it's been causing havoc, or probably where the cases have been far more rising comparative to our own continent called Africa. So yes, I mean, there is an element of community transmission. Good thing it's a milder disease for now. Its fatality rate is about 3 to 6%, still high compared to even COVID-19 now. But it affects, again, as any viral disease, to mostly older, elderly people. Pregnant women needs to be careful. People who are living with comorbidities needs to be like any other viral infection, exactly how we preach the COVID-19. So I think, yes, a small concern, but no panic at all.
Yeah. The MEC is saying it's a mild disease, as you put it, does not require hospitalization, but just isolation. Is that correct? So does it go away by itself? Is there treatment that is required for it?
So I think, monkeypox, if we understand, it's from a family of a very dangerous disease called smallpox. And we eradicated smallpox very successfully as humans over fighting, and smallpox probably has been a single disease that has killed many more humans ever lived on in the history of diseases when we discuss, or pandemics killing humans. But it was eradicated in 1968. But since 1968, what we have stopped is vaccination of smallpox. So age group of people who are below 50 years or 60 years have not been vaccinated with smallpox. And that's giving birth to a virus very similar from the same family as smallpox called monkeypox. And now, because of its mutation, without any resistance coming from our human body, this virus is now mutating. Now, the mutations are increasing in transmissibility from one human to the other, but not in terms of virulence. And the virulence is confined still to about 3 to 6% deaths. A 3 to 6% death is still a big number. Though in healthy individuals, it's a milder disease, it remains milder. And so far, we haven't seen fatalities to the level we were anticipating from a virus like a monkeypox. But people need to be careful. But at this moment, yes, home remedies. What we are going to be seeing if the outbreaks becomes more is that the smallpox vaccine is very effective against, even for prevention as well as treatment. In fact, the data of scientific data shows that if you can give a ring vaccine, so means all the contacts of the individual who's been tested monkeypox positive, if given a ring vaccine of smallpox within the first 4 to 5 days, shows absolutely therapeutic, means the infection further reduces to extremely mild, which means not only the vaccine is preventative, but also a kind of a curative in that. So this disease has been known to us. We actually even have antivirals around it for it. So we know how to crack this disease or treat this disease. Considering it's very viral, it's very mild right now, very few cases, almost negligible cases in South Africa. No panic, no need for ring vaccinations. But these are alternative things that we know and we can immediately put in place to immediately curb this outbreak.
Yeah. We know it's giving Europe a little bit of a problem, maybe some instances even wreaking havoc in terms of the numbers of the cases being reported there. What do we need to do to prevent that situation happening here in South Africa? I mean, the MEC, for example, pointing out to things that we were already doing during the time of COVID-19, like the wearing of masks, good clean hygiene of hands, and so on and so forth. Are those things particularly helpful? Contact tracing is another thing that the department is obviously putting in place. Will this certainly help us in terms of the control of the spread of this virus?
But Thabo, you're absolutely right. I think the first part is education. What the news channels like yourself are doing is making sure this information is reaching to the public. The people who are more vulnerable are the healthcare workers, the cleaning staff in hotels who are exposed, cleaning staff in residences, where congregations of people are, because it spreads through body fluid, So and the important part is that the rash that develops with the fever, because that's a major sign. The fever, body ache, headaches, like a normal viral, but followed with a rash. The rash eventually, like a chicken pox, if you know, develops pox on your body. And when the pox breaks, the fluid is very, very infectious. Now, the eruptions are mostly seen on the face and in the mouth. So kissing, saliva touch, it's in the genital area, so sex. So these are very high in close physical contact where one body fluid can touch another body and spread. And that's, I think, what we are seeing in Europe is exactly what we need to be careful in South Africa, is avoiding a physical contact with individuals showing a rash at this moment or showing rash with fever, because it is a possibility in a season where we have seen an outbreak of monkeypox where the virus has seemed to mutate and seems to be 10 times more transmissible compared to the existing monkeypox, because it's been with us for a long time. So people need to be careful about in physical contact with somebody with a rash. Report the rash and fever very quickly to a healthcare worker. The Department of Health, as I speak, has clearly trained all its nurses, its doctors, the health clinics on this disease so that the diagnosis can be very quick. Our laboratories are very equipped to diagnose this test very quickly. Again, isolation, contact tracing of all the contacts once the case is detected, like exactly the case in Limpopo, with all the 3 contact traced very, very quickly. In fact, more will follow once more contact tracing will continue, and then isolating those people or watching their symptoms. And as soon as symptoms starts, we start looking at how do we ring isolate people, and should the spread of the disease be further or be more severer, then I think hospitalization and more importantly, ring vaccination will start coming into play.
Higher Health CEO, Prof Ramneek Ahluwalia, appreciate your time as always. Thank you very much for coming on tonight. Right, in a moment, we hear what's happening in your sporting world. Valen Kirtley standing by to bring us the latest.